So today we will be discussing about how to use various resources to study. Actually, anesthesia is a very dynamic field, and if you just try to find out a single source which will be giving you like whole of the concept, unfortunately, it's really difficult. The commonly used books which people use like Morgan, okay. Or there are a number of books which are called as a textbooks. Okay, unfortunately, they are not serving the purpose. Um, like you can see here a number of books which are available. Some are big, some are low. Like this one, Starting Anesthesia and Coexisting Disease. Then this Miller, Barish, Morgan, okay, Atkinhead Smith, Oxford. So there are so many books, this problem oriented. The problem is that I'm not saying that uh, like you should not read these books, but can any one of you tell your experience, Jamila Begum or Abdur Rahman, that how you study? Can you just I just want to listen from you guys, and then I can correct you, or I can just give you my opinion. Yes, Abdurrahman or Jamila, would you like to speak out, please? Anybody home?
Yes, doctor. So, for my experience,
Yes.
the basic information from the textbook, yes, they are necessary, but as you mentioned, they don't serve the whole purpose of practicing anesthesia, and you cannot rely solely on them, as many skills and knowledge can be gained only through practice.
Yeah, practice and like Abdurrahman, which book you usually read?
Uh, I was reading mostly Barash and Morgan.
Okay, so Barish. So can you just
Barash.
tell me which topic you read from any topic you giving example so that I can explain from there on. So any topic which you
Uh,
read from Barish.
for example, the MAC, the sedation.
MAC, okay, monitored
Mm.
anesthesia care.
Yes.
Okay, so I will tell you because you have read from that. I have not never read Barish. I can just say salam to Barish or Miller. I
Mm.
find myself doha and sedation when I read from these big books. Okay, but I will tell you the aspects which are required from Mac, and you can tell me was this information there in that book or no. Okay, so actually,
Okay.
first of all, what is monitored anesthesia care? Monitored anesthesia care is provision of uh, anesthesia care, a trained anesthesia personnel with all the basic anesthesia monitoring, standard 1 and standard 2, with or without giving anesthesia. So this is the basic concept of monitored anesthesia care. Okay. So
Mm.
whenever they are asking you about monitored anesthesia care, first of all, you have to explain this thing. Then the thing which are maybe required is how do you define the level of sedation. Okay, so the level
Mm.
of sedation is usually defined through the Ramsay scale.
Mm.
So Ramsay scale, and then what are the, you can say that prerequisites when you are evaluating a patient suitability for MAC. Okay, like
Mm.
what cases can be done. You can say suitability or exclusion inclusion criteria. Okay,
Mm.
exclusion inclusion criteria. Then what are the places where you can give MAC? Okay,
Mm.
because there will be certain places whether you where they you are giving because one aspect will be NORA, non-operative room anesthesia. Okay, and
Mm.
one will be inside the OR, but either because of some patient condition, okay, or this is one reason, or the procedure requirement. Patient, the procedure does not require the general anesthesia and can be done under local. So these will be two different categories in which you are providing MAC. Okay, either the procedure does not require full anesthesia, number one, and number two, patient condition is not suitable for monitored anesthesia care. So these are totally different group of people who require monitored anesthesia care. Okay,
Mm.
so this aspect you should be knowing, because till the time you don't understand this thing, you cannot understand this topic. Okay, so this is
Mm.
another point. And then and then like though monitored anesthesia care, you should be knowing what sort of medications you can use. Okay, and what are the complications which can occur during MAC. Okay, and then there will be complication, generalized complication, which will be related to mainly because of airway and breathing, and any circle, like I'm just telling you in that order, but any cardiorespiratory or like hemodynamic or respiratory, like airway collapse, you are giving monitored anesthesia care, the level of sedation became increased. Okay, and
Mm.
patient collapse, or there will be certain complication with reference to local anesthesia. Okay, or
Mm.
there may be certain patient one of claustrophobia, like as occur in like ophthalmological procedures, which are commonly done under monitored anesthesia care, or may be related to local anesthesia toxicity. Okay, so
Mm.
these will be the challenges which you can face during monitored anesthesia care. So this is just an overview. So now tell me what these, and this is not, I'm not even counting the procedure, because if you go, so you should be knowing what sort of procedures. There should be a procedure list which can be done under monitored anesthesia care. So that will be some expanding of this topic. Okay, so now you tell
Mm.
me, please, Abdurrahman, that which of the things were written in your book?
I can't exactly remember, but yeah, not everything is mentioned.
Yes.
And if it's
Not is
mentioned, it
not
will.
matter everything. You know what will happen, Abdurrahman? So you just
Mm.
give me your opinion. The thing is that under the heading of monitored anesthesia care, you will not find these things. Maybe you will
Yes.
find it scattered in different topics. Am I right? What
Yes.
do you think?
I agree.
Okay. So now how to bring it in one place? So if you are above average and you are able to integrate this disintegrated, scattered knowledge in one place just by reading cover to cover book, then it's fine. Otherwise, the best way, like what is the alternative? The alternative is that instead of a book, you make a topic a source. Okay. So
Mm.
like whenever we plan to go to any place, we say, okay, we require this much money. We have to go by this airline. We have to stay in this hotel. We need this visa. We need that much that place from where we will get the food from basic requirement. These are the places where we can visit, whether we need to hire a company, whether we want to hire a car, whether we have to move on any public transport. Okay. And what, like, this is the way you plan any trip. So same is true for topic. In the way which I just created, this is what is called as a mind map. Mind map. Okay. And just to give an example, you will find here in the link a source mind map. I will just show you. These are very few. This is, you can say, nothing topics, very few of them. Okay. But this is a concept what I want you to learn, that whenever you are reading any topic, make a mind map. Okay. Make a mind map of that topic. Like, for example, just instance, you can open it and you can have a look. Amniotic fluid risks and incidents and treatment and pathophysiology. Okay. So this is apropos sign and symptoms. Uh, so this is just a mind map of a one topic. So whatever topic you want to read, please make a mind map. So when you make a mind map, the thing will be that you will be able to chalk out that topic, just like I give you an example, that you plan a visit to a certain place or certain thing. Okay. So what is your opinion, Abdurrahman? Is it good? Sounds good.
Yes.
Okay.
And
So
more organized.
Yes, because the thing is that I say another thing, because I am in love with anesthesia. It's my crush since I was in medical school, and I used to say that I love anesthesia every day more than yesterday. Okay, but the reason for it is it's a hell of a specialty. Okay, the people take it very lightly. Even the people who are working in anesthesia, some of them are not really committed to it, and there are people who came because they did not get any chances in any other specialty, they come to anesthesia. So believe me, these are the people who don't understand what anesthesia is. Okay, because the thing is that the thinking of anesthesia is like octopus. We have to work like an octopus. We should have two eyes behind. We should have five ears. We should have, even we should have the ability to pick the problem by sniffing, like an intelligence maneuver, like even the watchdogs. So we should be knowing everything, because if we fail to understand our role in the operation theater or in perioperative care, unfortunately we will lag behind. And then another problem, another big problem, because internationally, maybe few decades before, anesthesia was not a established specialty, and actually ICU was combined to anesthesia. Okay, and in recent decades, pain specialty also developed. So now anesthesia has overwhelmed actually. Okay, and what happened that in many of countries, ICU is separate and anesthesia is separate, and unfortunately this has make our life even difficult. The people like me and many people who are working in that part of world where anesthesia and ICU is one specialty, I can say that we we have more responsibility, and we actually need to have more depth of knowledge as compared to the people who are working purely in anesthesia. I'm not saying that they are not good, but the thing is that because people who are working both in anesthesia and ICU need more depth of more depth of knowledge. So I always request all of the people, even who are working purely in anesthesia, they should not leave their knowledge out of operation theater. They should extend their knowledge in ICU, because if they don't do it, they will lag behind. Okay, even if the ICU is a separate specialty and you are not being asked even in your program, please don't miss the things which are required in post-operative period, because maybe few years later, maybe they will understand this thing again, and the post operative ICU will be under anesthesia, because there is one medical ICU which you can say a little different, but the post anesthesia care or post op ICU care, or another aspect I would say, HDU, high dependency unit, they all the things which are there should be the domain of anesthetist, other than rather than the only ICU people. So this is another thing, because a number of topics which we read, people don't read too much, because they say this is related to ICU rather than anesthesia. Okay, so this is another important point you should be thinking. Okay, so now one more point I want to highlight, and because uh, in majority part of world, there make the major system of evaluation is MCQs, or you more specifically, so you say best choice question as BCQs, and the oral part. Okay, the oral part is divided into two parts, like one is OSCE, objective structured clinical examination, or whatever you say it as, this clinical tasks. Okay, and the oral part, and one of them is called as long case. Okay, and one of them is called as short case, or you can say that in which, like, one there are multiple tasks in one case as a whole, and one of them is short case. Some part of world still, like, which what I will say, has a different exam pattern, which some of the part have don't have. Well, that is, one is of them in MCQs, they have multiple true false. okay, MTFs. And in the written, they have SAQs, or more recently, they have changed it to CRQs. So short answer questions or constructive response questions. I know that majority of part who don't have this one, they don't even practice. But my point of view, if you understand the mind map, you will you will understand this thing as well. So I will just show you some of the books here in this folder, in the book folder, and you will open this SAQs. And in SAQs, the short answer questions, there are a number of books. These are just practice books. And recently, in last maybe few of the years, the CRQs pattern is also there, which is constructive response questions. Okay, so it actually it is more like oral part in which they are asking you, but the difference is that you are not speaking out, you are writing it. And like they will give a scenario, and then they will ask what is the next step. Okay, what will you do? Then they can ask you what is a possible differential diagnosis. Okay, like you, what are the possible, like you see this, for example, this is not familiar to US system, even in Saudi Arabia and in some of the countries. This CRQs pattern or SAQs pattern is not there, but I'm just giving you a taste how this pattern works, because when I was trained in Pakistan, our exam pattern, because still in UK, in Ireland, they have this SAQs and CRQs pattern. Okay, they are still there. And because I have passed my exam in that time, our pattern was this one. Like we have SAQs, we have MCQs, and we have oral part with including a long case, OSCE, and a table viva. So recently they have removed the SAQs part in our country. Okay, so now the people who are appearing in the exams in our country right now, unfortunately, they are not preparing like that. Uh, CRQs is even an ultra form of SAQs. Okay. So you see in this scenario, what they are asking, that a patient is coming 32 unconscious. Okay. And craniopharyngiomas and VP shunt, suspect that patient has hydrocephalus because of VP shunt. List two other possible neurological diagnosis based on the informative information above. List two symptoms and four signs of an acute rise in ICP. Okay, so this is just your mind exercise. You can find the answers in the later part of the book. So this is just an example, and even what why I'm giving you this taste, and I invite the people, even their exam pattern is not asking such question. Believe me, this will give you a very good taste of your knowledge. Okay, and this is a wonderful way of checking out your approach. Okay, so you can have a look on these books, and it will help you building up your concepts. Okay, this is one point I wanted to highlight. Please use them as a, it's just like a library. It is just like a like, you have hundreds of dresses in your cupboard, so you use them according to the requirement. Sometime you are you are using party wear, sometime you are casual wear, sometime you are going on a bachelor's party, so use your dresses accordingly. So similar is like, again, if you want to understand anesthesia, if you will read these books also, or you just have a look. Okay, even if you read the question and just try to figure out what will be the answer, this will give you your knowledge real, it will be really beneficial for you. So you can have a look here. Okay, so other thing, I just wanted to show you this MCQs. Okay, so this folder you will find hell of MCQs books. Okay, so I have divided it into best choice questions, basic science MCQs, clinical science MCQs. There are regional anesthesia MCQs, ICU MCQs, different various pools. The people who are appearing in this prometric exams of Gulf countries. So a lot of things I have compiled here. So the people again, then another thing which comes here is that basic sciences are not being asked in a number of programs. Okay, like if you want to know, if you are appearing in a British exam, you will find hell of basic sciences. So anyone who is pursuing for any exams of British caliber, They will have, and gradually it will, like I appeared in Irish fellowship exam, and I appeared in European diploma in anesthesia and ICU, and few other European diplomas. So their level was not as difficult as British, but still it was very difficult. Okay, so you, if you want to build up your knowledge of basic sciences, please, these books will help you a lot. And even if your pattern is choose the best, still, what will be the advantage? You open up these books, okay, and what I will suggest you, that you just open them, okay, and read any of the this is actually, by the way, choose the best. I will just show you. uh, Just a second. Okay, these are MTFs. So what will happen, that if you want to get use of this thing, the main topic is cardiac cycle. So when you are reading it, just review what are the steps in cardiac cycle, and then read these questions. So what will be the happening, that you have sometimes, even if you read, you want to just check it out whether you know about it is not or not. So this is will be a good idea, that you read this topic from anywhere you want, okay, and then just check it out whether you are able to answer these questions, okay. And another, how you to utilize them, there are two options. You can make the summary by hand in your notebook, or, because now we are generation Z, so we use different manuals. So another option will be that you make a folder in your mobile, and you record whatever you read that day. Make it a date wise and topic wise. It's up to you. And just whatever knowledge you learn from that MCQ or that part, just record that I read about cardiac cycle, this, these are the steps, this happens like this, even in your mother language. And it will be a very good way, that maybe you recorded 15 or 20 recordings of 2 minutes each, or 5 minutes each, whatever. And after few days, you just want to review what you have read, just plug in with your headphones, listen to it, and this will be a very good revision for you, okay. So because sometimes you don't have time to write it down, so that will be a very good way. So similarly, you can see coronary blood flow, left ventricle. So like what will happen, that if you read 100 questions like this, you will have 100 points, and gradually your knowledge will be built up. And even if you are only appearing in choose the best, the knowledge will help you out. Unfortunately, the approach is that you are reading the pools, you are reading certain books, and you just want to pick out the choose the best question. I know that this will also help, but if you want, again, because my concept of knowledge is totally different, I want to tell you that exam is, yes, it's necessary, but it should not be the first priority, because believe me, your life as a doctor will start after you finish the exam. Nobody in the world, the normal person, will stuck in the exam forever. They will pass in 1 year or 2 year. Maybe if you are not a good student, if you are not studying the things in order, maybe you will fail one time, two times, ultimately you will pass. But if you don't utilize your critical thinking and make a concept and try to understand practical conduct, as well as Abdurrahman, and the start of the discussion, as you said, Abdurrahman, that practical conduct is very important. But the thing is that you have to understand that topic from right, left, up, down, alpha angle, beta angle, theta angle, whatever you say, and then only you can say, yes, I know the subject. Okay, because the practical conduct, when it come, even it will come out of it one topic, and now you have multiple topics together. You have a patient. The scenario will be, you have a 80 years old baba with diabetes, hypertension, ischemic heart disease. Patient had PCI 2 years ago. Patient had 4 stunts, and patient had a permanent pacemaker. And now that patient is coming for transurethral resection of prostate. Now this scenario will come. So now what will happen, that your next approach will come, that you have to combine three things together, okay. And usually what will be that, one will be the patient type. I actually again and again tell this thing, patient type or category. This is one thing. And category will be diabetic, hypertensive, elderly, smoker, alcoholic, neonate, obese, pregnant. These are certain groups of categories. Even in discussion which I did few days ago, I highlighted the same thing. So this is one thing, patient type or category. Okay. The second thing will be that specific disease or specific thing in that. And the third thing will be surgery. Okay. So in the scenario which I told you, the you can say patient category was diabetes, hypertension, and elderly. So this is because these are very common things. So these are a category of patient which you will face, and immediately you will scan yourself. What are the challenges in anesthetic or in elderly patient? So this will be in one consideration in your mind. The second thing will be here, for example, ischemic heart disease and this cardiomyopathy and this heart this pacemaker. So this is the disease specific thing. And the third thing is surgery, TURP. So whenever the word TURP come, maybe the patient has hydronephrosis because of obstruction. Okay. Maybe patient already has lost some of the kidney function. Then patient may develop. I'm only talking about TURP. That's how you should be concentrating. So maybe patient might have develop hydronephrosis, renal failure, patient might have cancer, prostated cancer. Okay. And you don't know, maybe. Okay. So you have to understand this thing, the surgical concerns, and this is the information you will be getting from the patient chart, patient itself, and the surgeon. Okay. What are you expecting? What is the size of prostate? How much time you will take? What will be the technique? Because right now they are only also doing it with the laser. Okay. So in laser, sometimes they are using normal saline, not the previous solutions which lead to this TURP syndrome. Okay. So glycine toxicity and overload and hyponatremia, everything will be coming in your mind. So, and then the surgery related also important thing will be the patient will be done in lithotomy position. Okay. And TURP procedure may be urgent in case there is obstruction. So in obstruction, if the patient is not stabilized, maybe they are only doing suprapubic and get the time to kidneys to settle down, and then they may be doing the procedure, or this is an elective case. Okay. So this is what anesthesia is. So if you want to learn, and this, just tell me now, Abdurrahman, my again question, where will you find such scenario? Will you find a specific book in which these three things will be combined together, my dear? Yes, Abdurrahman. Again, I am coming back to you.
Yes, I can say.
Yes, what do you say? Like, because patient type category, some of the disease, and the surgery. This is the practical challenge you will face,
Yes.
even in the written part, MCQ, oral part, or forget about the exams, the practical. Now the practical world is coming to you. So
Mhm.
now tell me which book you will study. Morgan or Miller or Barish. Where will you find these things together?
Yes, I will get lost between these
Yes,
books.
between books and practical. And unfortunately, that is the reason we fail in the exam, or we do some mistake when we are doing a practical conduct of anesthesia. So if you want to, I would suggest you to be a free bird. Okay. And take every case in that approach. For that, I give you, because whenever I talk to people, I give certain examples, and I am just trying to bring all the examples. Like I give an example of trip, I'm giving example of another thing. If you want a mutton curry to be prepared at home, just tell me any of the lady, or even just think, will you say in 30 minutes, is it possible to make mutton curry at home? Impossible. Why? Because the things are not arranged and it cannot be possible. But same, you go to a restaurant, and in the restaurant you order, and in 30 minutes you are having a very tasty mutton curry. Why? Because they prepare the basic things. Like they will prepare all the things which they have to drink, ginger and onion and tomato, and even they have boiled the meat maybe. So now the food is made very quickly. So same is true for your answer. If you prepared a common pathway, okay, a, a common format for your anesthesia care or for compiling an answer, it will become much easy for you. So I will, it's just a simple example. It's no, I will not say, because still there are a lot of improvements which can be done, but I have just made a very simple way by which you can make your anesthesia, because your anesthesia care will start from the pre-anesthesia evaluation and optimization and referral, and then according to the patient category, according to the disease, and according to the surgery, you will make amendments to different things, but usually this will be a format which you will be using. Okay, that for every patient you need to know what is the disease, what is the category, what are the effect on airway, cardiac, respiration. Okay, what are the risks, what is the cardiac risk, what is the pulmonary risk, what is renal risk. Like for instance, renal risk, if any patient is diabetic, it's a renal risk. If any patient is taking steroids, it's a renal risk. If any patient has baseline renal impairment, this is a renal risk. Any patient who is having a surgery in which there is massive fluid shift, or there is hypotension, or there is fluid loss, or there are controlled hypotension, this is a renal risk. So I'm just giving you one example. You will chalk out the renal risk in that patient. You will chalk out aspiration risk, PONV risk. Like if female gender, it's a risk. Previous history of PNV, it's a risk. Use of opioids, it's a risk. Or any surgery in which you are playing with vagus nerve. Okay. Any surgery in which vestibulocochlear system is, this is a PNV risk. So what is the reason? What is the way of you using this? This is the format how you plan your anesthesia. Okay. So this is the same thing how you make mutton curry in 30 minutes in restaurant. Okay. So if you tune your, like making a format, and rather than reading from a book or from any source, you make a format in your own way. Okay. And fill every case or every disease in this way. So what will be the advantage? That you will immediately plan, okay, this patient is to be done in lithotomy position or in prone position. Okay, so these are the concerns in prone position. Immediately you scan your brain and the result will be there. Okay, this is the diabetic patient, so I need to check the blood sugar. I need to control the blood sugar. I need to see if the patient has any acute emergency like DK or hyperosmolar or this hypoglycemia. Okay, or the patient needs insulin, so insulin related problem, patient can become hypoglycemic, the requirement of insulin will be changed. Okay, okay, no, yes, I know that I have to use fluids according to the blood sugar levels. Okay, I have to modify the insulin regimen. So these are basic thing with reference to insulin diabetes. So same is true, will be true for all the surgeries. So this is the basic format. It is just a sample. It's written by me, myself, by my thinking. You can make your own format. Okay, because whatever your data you will translate into practical conduct. So you will decide, okay, this patient has renal risk, I will take care of this thing. Okay, this patient has difficult airway, I will manage that in that way. Okay, this patient has autonomic problem because of diabetes or uncontrolled hypertension or any reason. Okay, so I need, other than standard 1 and standard 2 monitoring, I need a cardiac output monitoring. Okay, I need invasive blood pressure monitoring. Okay, I need to take the this arterial line in awake before induction. Okay, I cannot do the rapid sequence induction, I need to do the modified rapid sequence induction. Okay, it's not safe to give propofol, I will use etomidate. So these are all the things you will be planning according to the patient category, according to the disease patient has, and according to the surgery. Okay, so I hope you are with me and you are understanding the highlight of what I wanted to tell you. So this is just an overview. You can make a format from your side, and then what will be happening: pre-medication monitoring, induction agent, muscle relaxant, okay, maintenance, analgesia plan, what fluid, recovery, post-op course, where you want to send the patient. So these are the things which you will be getting in every patient. So make a format. And then whatever source you are reading, whatever Miller or Barish or anesthesia, coexisting disease or Morgan or whatever you name anything, or now I just want to show you articles, the world of articles, the review articles. This is which are the best source of knowledge. The you can say, if you want to choose between what is the most realistic source, these anesthesia tutorials, okay, or this BJ education or updates in anesthesia, you will find the most, and this is another very good source. Okay, I have arranged them year wise, and it is all for you. You can use them as a library, and then you will pick that topic. Maybe you need to search out a number of articles, and from that you can build up your knowledge. I know that's not an easy job, and people, oh, we are lazy, we want a simple source, oh, can you give us some notes? So unfortunately, if you want to be a good anesthetist, you cannot have, there is no free cup of tea, there is no shortcut. Okay, and it's, believe me, if you practice for some time, if you practice for some cases, you will understand. You are not dumb. You are not duffer. You will understand what's to do. And even you don't need to read each and every article all the way. Okay, you just will scan through it. And like, for example, this topic is on obstetric hemorrhage, and it is just published a month ago. Okay, so you can just have a look. A lot of things, from wherever you have read, just open, read the learning objectives. So this is one thing. Just read the topics, the headings. Okay, scroll through, you will find certain charts. Okay, so okay, I know this. Okay, this is something new. Okay, this is a very good chart. Take a picture, screenshot, save in one file. So this is how to use different sources. Okay, the advantage will be, you can see that it's not a perfect source, but it's a very good source. Okay, you will see the medications coming, the different ways coming. What are the problems? So in this source, you will understand this topic. Okay, one thing I want to ask, because whenever the word article come, there is a lot of confusion. Abdurrahman or anyone, what is difference between review article and research article? Can anyone tell?
Usually, the review article is combining multiple articles, like a
Very good.
meta-analysis.
Meta-analysis, like, it's a review of that topic from the whole aspects, the same thing which I am telling you. Okay, so review articles and even the books are written from review articles. And research article is a simple thing. Okay, research article, anything you are saying that lidocaine is better, or bupivacaine is better for certain things. Okay, so this is a research, and on the basis of a lot of research or different sort of combinations, then you make review of all the available data, even books, then you write a review article. So these are the things which I am showing you. These are review articles. Okay, so in this folder there are two different folders. All of you are welcome to contact me anytime if you want to know about anything, because all these things I'm doing it just for the sake of helping and supporting myself, for to start with, because whenever I'm telling you, it's a revision for me. And of course, because I told you, this anesthesia is my darling. I love anesthesia, and I want to just spread the knowledge of anesthesia wherever, whenever is possible for me. So this is all for you. So this is one source is year wise. Okay, and I'm trying to update the folder. Unfortunately, I'm not able to update it in the best 100 absolute way, but at least I have compiled in topics. So this is gynae peds, elderly, cardiac respiratory. So if you open any of the source, you will find all the possible review articles which are there here. It's not perfectly, I apologize for that. I'm trying to update it as much as possible. Okay. So if you combine these two sources, you will get the best result. I'm trying to put all of the articles year wise into the topic wise, but unfortunately, I'm doing it all alone. It's not an easy job. I have taken, you can see I have taken extra storage to keep it updated. This is all again, I tell you, I'm doing it for for my specialty. Okay. I need helping hands. I need support, and I don't want to make it a one-man show. It's a message. You can do the same thing wherever you are. Teach others around you. Help others around you. Whatever, like you prepare any topic, teach someone. Because what will be the advantage when we do girgir? This is word which you use a lot in Arab countries. If you do a lot of girgir, you will not forget that topic. Okay? And the best way to learn is to teach. So if you start teaching, believe me, you will not forget the topic. So that is what I wanted to tell you. And these sources are there for all of you to use. Okay. So there are different type of another thing which I have just posted here is viva scenarios, different viva scenarios, and actually viva scenarios or SAQs almost are the same. They are not different. Only different is that in the SAQs you have to write, and in viva you have to speak out. Okay. And another thing which I used to say, that postmortem of various topics. So I'm not able to do all the topics, but I have tried to do post-mortem, or you can say the autopsy of all a number of topics. So if you will open this folder and you will find a number of topics being done, lines like that. What's the difference between for this anaphylaxis, anaphylactic versus anaphylactoid reaction? Is anesthesia related reactions mainly anaphylactic or anaphylactoid? What is anaphylaxis, or what? How to differentiate? What to do? So you will find topics being the goals are created. So now you can find the answers from anywhere. Okay, you can use the, if you now, if you see this topic, you come here, you go to this folder. Okay. uh, so because anaphylaxis is a complication, so you will find here a folder of complication. You will go here, ICU and complications, you will go here, and you will find anaphylaxis here. Okay. So all the topics related to anaphylaxis I've put it there. So that's how you will use this resource. Okay, there is another way to find it. You just write in the drive, you write anaphylaxis. Okay. Maybe the topic or maybe the heading. So you will find in that way as well. So these are two different ways for you to use the link. If you want, if you are not finding anything, please drop a message to me. I will be very happy to help you out. But I would like you to learn. I would like you to help others. So if you will become a lazy duck, unfortunately, you will not help the cause. Okay. So thanks a lot, all of you, to spare this time. And sorry, I was a little late. But remember one thing, take ilm as ibadat. Okay. You will pass. But if you take it as, because we, as a doctor, we are nearer to Allah. The like, you can say, we are treating human beings. We are treating someone's mother, brother, sister. So it's a big responsibility, my dear. Okay. Because just imagine your mother or father ill, need care. Would you like to be treated from someone who does not know the subject fully? No, not at all. You would try to get the best in the park, best in the world. Okay, and even you will want to create someone who is even best than best. So why don't you become best for someone other's father or mother? And you can do it. Believe me, in innamal amala bin niyat. If your intention is clear, believe me, you will get what you want and what you should. Okay. So thanks a lot, all of you, to spare your time to listen to me. And my all discussions are there in the YouTube channel. And again, conflict of interest, it's a non-monetized channel. I have you clearly written here that it's a non-monetized channel. You can see non-monetized efforts for all. And the discussions are like this. They are not very beautiful, elegant presentations, but I have tried to cover a lot of subjects because whenever I am getting time, I'm teaching, sharing the topics. So you will find in playlists. These are, majority of discussions are in English. Some of them in are my language. So pardon me for that. But majority of them I try to do in English. So you will find how to study some about career counseling, endocrine, MCQs discussions, physics, equipment, pharmacology, basics. Unfortunately, I am not able to them to cover all the topics. I try to do it because for basics you need to read very in too much detail to teach. But I have made a lot of things, so you can find. If you don't find any topic, please let me know. I will share it to you, so you can find here a lot of topics. And actually, this is my main like problem-based discussion. And another thing which I stress a lot is preoperative assessment based risk stratification and planning, because this is my main what you say, my main concern, that if you understand this thing, so it will be easy. So how to interpret investigation, how to interpret, I have made a lot detailed discussions for this. And then pediatric patient for anesthetist, pregnant patient for anesthetist, renal disease patient for anesthetist, please listen to them, you will get a lot of benefit, because this is totally practical things which I have tried to highlight it here. Position related concerns, how to optimize anticipation before surgery. Whatever I told you today, a number of things I repeat again and again and again, because believe me, anesthesia is all planning. If you know how to plan anesthesia, it will become very easy. Okay. We discuss about preoperative assessment. And actually, this is not only preoperative assessment, this is all planning. And anesthesia is all planning. Okay. So I have discussed about ERAS as well here. So this is, I'm just showing it to you so that how you can utilize. But still, if you don't understand, I'm there to help you out. So thank you very much. Inshallah, we will meet again. Any questions before I finish? Abdul Rahman, I just want to thank you, especially from which country you are?
I'm from Saudi Arabia.
Saudi Arabia. Okay. So you are doing Saudi board?
Yes, I finished 1 year ago
MashaAllah. So where are you working now?
in King Saud Medical City in Riyadh, Shumaisi.
My God. So you are my in my previous home. I worked there.
Oh, really?
I worked there for 2 years, and now
Oh,
I am in
mashallah.
military hospital.
MashaAllah.
Okay. So
It's a
say my
pleasure.
salam to everyone in Shamesi. Okay.
Inshallah. Inshallah, I will.
Okay. Okay,
Thank you
my
very
dear.
much, Dr.
So
Syed.
thanks a lot, all of you. Uh, okay. Bye bye.
Bye. Thank you, Dr.